Our next speaker, Stephen, is one of our own. He works as the Programme Manager for the British Safety Council's sister organisation, Mates in Mind, known internationally as Think Talk Together. Stephen specialises in the design, implementation and management of workplace health and wellbeing. Prior to working with us, he was an advisor to the Mayor of London's Healthy Workplace Charter, and he's also assessed organisations against the Charter's standards. So please give him a warm welcome. Stephen, over to you.
Lovely, thank you, James. Well, thank you very much, James, for that introduction. Hello, it's an absolute pleasure to be here. So, as James said, I'm Steve Haynes. I'm the head of programme for Mates in Mind, or as we know internationally as Think Talk Together. I suppose one of my key roles is around helping organisations develop and optimise mental health and wellbeing programmes. And a lot of my work is in helping companies understand their data so they can take a more informed approach to developing relevant programmes for their business. In the next 30 minutes, you'll probably be pleased to hear that we're not going to be talking about what wellbeing is or what the business benefits are. I think our esteemed speakers throughout the day have quite nicely done that. But what we are going to focus on now is the how. Specifically, how can we use our data to support our business case and our strategy? So we're going to be thinking a little bit about what data should we ideally be looking at? How holistic a picture of the well-being of our workforce does our existing data give us? How informed an approach can we take based on the strength of that data? And equally, let's explore what our data isn't telling us. And of course, importantly, how can we optimize the measures behind what drives our data? Thank you. Can we jump to the next slide, please? Thank you. Okay, so let's kick off with a quick poll to get us thinking about the types of information that can help inform our programs. Megan, could we launch the poll, please? Thank you. Okay, so take a moment to think about which data your organization currently looks at to inform your workplace wellbeing program. So that's not just the data you currently capture, but which data do you currently use to inform what you do? And we're going to look at employee survey data in our second poll in just a minute. If you don't currently look at any of this data, don't worry, don't feel you need to answer. Don't worry about answering if you don't currently look at any of this data or if you're not sure. Over to you. Okay, how did we get on? Fantastic, thank you, Megan. Okay, so unsurprisingly, the big chunk there, absence of occupational data outputs, still quite a lot on return to work interview outputs. That's really encouraging. Turnover data, interesting. That's really good to see. A growing number there from looks at around individual stress risk outputs and intervention utilization. So your health insurances, your EAPs, again, not too surprising. Okay, fantastic. Thank you, Megan. Let's jump to the next slide and the next poll, please. So let's think here about what employee data we're currently looking at. Again, think about the types of employee data you currently capture and use to inform your wellbeing program. Thanks, Megan. Let's just give 15, 20 seconds just on that. Again, if you don't currently capture the data or you don't look at any of it, don't worry, you don't need to answer. Okay, how do we do? Okay, so that's not too surprising. Again, that would mirror with what we find with the organisations that Mates in Mind and Think Talk Together. We work with around 460 organisations across the UK and internationally. So yeah, not a million miles off with what we're already seeing. Megan, thank you for that. Okay, let's jump on to the next slide. Thank you. Okay, so let's start by putting things into context before we get into the nitty-gritty of the data. So if we look at each of the different evidence-based approaches to addressing mental health and well-being at work, they can be broadly summarized into something not too dissimilar to this. So firstly, the assessment piece at the top right, at the top, understand our organization and our people. So both from a policy and a procedural perspective, what's already in place, how consistently is it applied or adhered to, how relevant is it to our business, what data do we currently capture? How robust is that data? How robust are the measures that inform the data? And also from an employee perspective, how well are our employees? How informed and robust is the data that supports this? Are we looking at single or multiple sources of data? How frequently are we looking at the data? Who's analyzing the data, and so on? Ultimately, data plays an absolutely vital role in any workplace mental health and wellbeing program. To ensure the right interventions are put in place, we've got to make sure they're based on credible data. As I think it was the Chief Medical Officer, Sally Davis, cautioned us a couple of years back, she made this observation, which was, well-being interventions shouldn't be carried out without understanding the issues they seek to alleviate. Hence, data is critical, as is what's informing and how credible is what is informing our data. At the end of the day, business leaders don't make key business decisions based on uninformed data, and we know that our people are instrumental to the success of any business, so why should the decisions we make around employee well-being be based on anything other than informed data? We also need the data to help us understand what we're actually trying to address when we're talking about addressing mental health at work. Is this about improving work organization and job design? Is it about promoting healthy behaviors? If so, what are we actually trying to address? Is it about improving the identification and management of work stress? Is it about optimizing attendance management, rehabilitation, or return to work, or a combination of all those? So our data can inform the right intervention and support infrastructure for our business. So importantly, when we think about our support infrastructure, we also need to be thinking about our employees and our managers and our leaders, because everybody and everything, not just the helpline, the wellbeing interventions or the health-related insurances, everything plays an equally important role, critically our people, in the overall support infrastructure. And we'll come back to that in just a minute. So once you've got the right data and you've optimized the measures behind what's driving your data, you're in a much better place to be able to monitor and review your ongoing program and then ultimately align employee wellbeing to your bottom line. It's also critical that you've got the right people doing the right things. Megan, can we jump onto the next slide, please? Thank you. Thank you. So ideally, look to formalizing your program ownership and roles and responsibility. We've got to ensure we've got senior level ownership and engagement. We need the business leaders to have oversight and be accountable for the well-being of the workforce and the bottom line. We need that program steering group made up of the right stakeholders, whether it's HR, health and safety, because they can plan and play a critical role in the design and development of the program. Ideally, we need a program management function, whether it's one person or one function, but that person, the individual that's responsible for the stakeholder engagement, the data management, the program design, someone who's going to collate and analyze those multiple data sets so that together with the steering group, we can make informed decisions about the workplace wellbeing program. And then, of course, employee representative groups and functions who, under the direction of the program lead, can play a critical role in capturing the views and opinions from the wider workforce and even be involved in implementation of localized initiatives. And then, of course, driving that through the workforce. Megan, can we jump onto the next slide, please? Thank you. One thing that we talk a lot about is, the concept of pulling all the relevant data to give us a nice holistic picture. So I talk a lot about this proverbial dashboard, this centralized data dashboard, which provides you with this holistic assessment of all relevant data points. In their paper, I think it was about middle of last year, the What Works Wellbeing Center identified a whole number of initiatives and activities and programs need to be putting in place that can really improve well-being. And it highlights a lot of things that really matter when it comes to how interventions are implemented so that they ultimately achieve what they set out to do. And from ensuring employees and managers are supportive of wellbeing initiatives to having adaptable, good quality systems in place. And it also outlines some principles to consider when implementing wellbeing programs, which all make good common sense. That's things like clear communication, a nice, clear, coherent program, commitment from the right stakeholders, consistency, and creativity, which I love, because we should never forget the creativity element in program design of workplace wellbeing. Whilst we need robust data to help us put in place informed and relevant approaches, sometimes good wellbeing initiatives do just happen by accident. Next slide, please. Thank you. Ultimately, the more we know, the more informed approach we can take. For example, let's take an example of, say, psychological first aid models, or, for example, training a cohort of staff in the 2-day mental health first aid or equivalent course. What gap will this additional support measure be filling in your business? How will your model be integrated with your overall program? What data will you record and monitor? If you're going to introduce, say, a financial wellbeing intervention into your business, again, how robust and comprehensive is the data that's going to inform that decision? And next slide, please. And let's also think for a moment about where we're ultimately going. I trust you will get back to more of the data stuff in just a bit. If you think about where your business is right now in that proverbial well-being journey, are you just getting started? Are you developing? Or are you leading the way? Do you have various initiatives in place but limited holistic data to understand the real impact? Do you have robust methods of identifying exposures to, say, work stresses? Can we effectively link yet the well-being of our workforce to the bottom line of our business, for example? I don't yet believe there is a gold standard in workplace well-being because we are continually learning. We're continually developing and continually enhancing our approaches to employee well-being. Yes, there are best practices. Yes, there is a wealth of evidence, but this is still a rapidly growing field in science, and I feel would be remiss for me to sit here and say to you right now, once you reach this point, go no further. Next slide, please. It always goes without saying that we are spoiled for choice, aren't we, when it comes to health and wellbeing services and benefits. But no matter how extensive a company's suite of employee wellbeing benefits and services are, what I'm seeing a lot of now, probably more so in the last 18 to 24 months, is a lot more of organizations coming to us and sort of starting to question the effectiveness and relevance of what's in place. And that is not to undermine the value and importance of what's there, but more about getting us to consider how relevant is the design as a whole when it's based on a clear, holistic, and informed picture. And also, as organizations, are we getting the right benefit out of what we got? And we'll talk about that in just a moment. Megan, next slide, please. One way to think about our employee wellbeing design is to break it into primary, secondary, and tertiary. And for those of you that were lucky enough to join Carrie's talk this morning, Carrie talked a lot about the primary, secondary, tertiary piece as well. Your primary interventions to employee wellbeing design, they focus on the work organization and design, the quality and the safety of the physical environment, choice architecture within the organization, the culture, how workers feel about their work. Here we're identifying and addressing the drivers of employee wellbeing. Secondary interventions are about upskilling our people and our management, whether it's time management, stress management skills, equipping our managers with basic skills in how to manage the conversation around well-being and mental health, for example. And of course, tertiary interventions, you're focusing on the points of need, the treatment, the rehabilitation, the recovery, once things go wrong. And historically, much of the focus in workplace health design has been on the tertiary. Probably I'd argue the triangle there would almost be inverted to an extent. And I think probably in the last couple of years, we've seen a lot more of a shift to the primary as organizations start to realize, actually, we need to be doing more. We've got some great stuff here, but is it doing what we need to be doing? And actually, what do we need to be doing? Megan, next slide, please. Thank you. Many evidence-based papers out there. If you look at the Institute of Employment Studies working at home wellbeing survey last year, around a third of people have reported increases in work pressures. 40% said they didn't have time to get their work done. 40% have reported increased levels of fatigue. That same study also highlighted increases in musculoskeletal complaints, increased alcohol consumption, less healthy diets, less exercise. We're talking more, and we're talking more about the non-work stuff, the how are you doing? The pandemic's accelerated trends in workplace well-being like never before. An HR director commented to me the other day. He said, "Just Steve, that getting buy-in for well-being at work, it's no longer difficult. Now we're not having to sell the importance of this happy, healthy workforce to our board. To be honest, it was their number one priority the day we went into lockdown." And amongst the organisations that we work with at Mates in Mind and Think Talk Together, we've seen increased rates of anxiety, increased financial worries, and of course, of note, probably the biggest note from what I've seen is more managers being approached with the well-being related matter and conversation that they're not necessarily comfortable in responding to or addressing. The vital role that managers play in worker well-being is being tested to the absolute extreme. However, managers don't necessarily understand their roles or responsibility when it comes to the well-being of their people. And it's certainly not through lack of trying. Megan, next slide, please. We also need to think a little bit about employee help-seeking behaviours, because ultimately this is a key determinant of well-being program design and a key determinant to optimising the measures that go behind what drives our data. A question that I get asked quite a lot is, how can I increase my EAP use? But actually, is that the question they're really asking? Isn't the question really, how can I optimize access to the right support? Just because 1 in 3 of us will struggle with our emotional or mental well-being at any given point in time doesn't mean 30% of the workforce are going to reach out to a helpline. People will reach out to varying means of support. There are also numerous barriers to support. I don't mean, whether or not an employee happens to see the helpline poster on the notice board, but things like self-acknowledgement. Do I recognize that I may be struggling? How could talking to my boss actually help? What would happen if I talk to my boss? My boss's calendar is always full, or their door, or the proverbial door is always closed. Would they even know how to help me? Would I be able to express my issues appropriately? When's the right time and place, for example? Barriers to support and help-seeking behaviours are really important. They need to factor into ongoing design of workplace wellbeing programs. Megan, next slide. Thank you. We've also got to bear in mind that some people will find it easier to recognise changes and issues in those close to them rather than necessarily recognising or acknowledging signs in themselves. We also may be more likely to approach someone closer to us before reaching out to that professional help. And of course, just because the help's available, we should never assume that people will automatically ask for it. And of course, this all reinforces that vital role. Megan, next slide, thank you. That vital role of any workplace wellbeing support infrastructure. So contrary to some approaches to addressing employee wellbeing, externally provided support services are not the front line of employee wellbeing. Your people, your managers, and your leaders are. And importantly, leaders and managers are right at the very front, aren't they? As many of the talks have alluded to today, our managing the leaders are best placed to create those mentally fit and healthy work environments. They're often the first to spot and address issues in teams. Their behavior, competencies, attitudes can either add or alleviate stress and or well-being. And they're often that first line of support and a key gateway to referral to the relevant external support. Next slide, thank you. On that theme, let's just pick up on one last poll here. Let's just get a sense around the table. How confident do we believe our managers are right now in spotting issues and starting, responding to that well-being conversation? Let's just take just a few moments. How confident do you believe your managers are in spotting issues and starting, responding to a well-being related conversation? Megan, how do we get on? Thank you. Okay, yeah, so you're not alone. Again, with all the organizations that we work within Mates and Think Talk together, I would say that pretty much marries up with what we're seeing. Particularly some will be better than others. And certainly I would say that we see a lot of managers that will come to us from that perspective of, I want to do the right thing, I'm just not sure. So can you help me? And again, EAP services, for example, play a critical role here, or can play a critical role here for managers because of services such as coaching services, for example, they provide, or ACAS guidance around having that difficult conversation. Megan, next slide, thank you. So let's get back to the data. And ultimately, if we think about this, the more data, the more information we've got, the more holistic picture we've got. And by looking at multiple data sets, and not just single data sets, but looking at multiple data sets, it's going to give us a much more informed and a much more relevant input into our overall program design. And Megan, thank you. Just thinking about it, if you think about, if your absence policy is not consistently adhered to, you've also got to think about, are your data outputs going to be of much value? So again, it's looking at the measures which drive the data as well is really important. And also optimizing that support infrastructure. And by optimizing the measures behind what drives the data, we've got to look at the support infrastructure. And this is simplistically about maximizing every opportunity for accessing the right support, so minimizing those barriers, and so knowing and mitigating those barriers as well, but also minimizing the chances of an employee falling out of that support. Megan, next slide. Thank you. So let's take a couple of examples here. How can we optimize our support infrastructure and get the most out of the measures behind what's driving that data? At the end of the day, our data outputs will only ever be as good as what we're putting in them. So let's look at the EAP. As we probably know around this virtual table, probably one of the most effective communication channels for any EAP are our co-workers and our managers, not the posters. It's peer support, line management referral are the most effective channels for things like EAPs and, of course, many other support infrastructures. So let's think about that for a moment. Are your staff and managers comfortable starting that conversation? Are they comfortable in listening, recognizing, understanding what their boundaries are, and then ultimately signposting to what will, of course, be in many cases one of the most common first line of professional support in the workplace, the EAP? Peer support has a tremendous impact on people engaging in available support services. That's really, really critical. Also, EAPs provide valuable short-term solutions-focused counselling or brief counselling. They play one element of your wider overall support infrastructure. So in optimizing a model, consideration needs to be given to how each support or service is going to integrate with each other to ensure as seamless a journey with minimal barriers. Think about what we were saying about a moment ago. It's about maximizing every opportunity for accessing the right support, but also minimizing the chances of someone falling out of that support. So if someone's contacting the EAP, which we've got to be honest, can sometimes be very difficult for someone to A, necessarily get to the point where they acknowledge something might be wrong, to B, to find the time, then to make that contact to that EAP. What if they're not contextualizing? What if they're not getting across, how they're feeling? What might happen? Is it possible that individual may not then get the support? Line management referrals also will have a significant benefit in minimizing barriers and maximizing access to things like an EAP. And when looking at your EAP usage data, explore what's behind the data. For example, one thing we see a lot of is usage being referred to things such as requests for general information. So is there more behind this? Are there employees reaching out for support but don't feel comfortable or are unable to effectively express themselves, and therefore they're not progressing onto the support? Consider the conversation and management skills of the EAP call handlers. Who do people speak to first off? Is it a counsellor? Is it a trained call handler? Things like active listening skills, formulation and support, for example, will influence the EAP service's ability to uncover comorbidities, to elicit as informed a picture of that employee's overall mental well-being as possible, and critically ensure that the most appropriate support is provided. And if that EAP can't provide the support because maybe that individual situation falls outside brief counselling or short-term solutions-focused counselling, we need to know what happens then. Where is that EAP then signposting that employee to? Or are they just backing that person up to just access for general information? Also think about, how does the EAP currently categorize employee health and well-being at point of entry and at point of exit to the service? Do we know the distance traveled of people using our EAP services? What case management services could be provided, for example? How's the EAP integrated with other services you provide? If it's not already, start the conversation. Get your providers talking together. Megan, thank you. So let's quickly close up on a couple more points here. So let's think about optimizing your support infrastructure when it comes to absence data. So when considering absence, think about both your inputs and your outputs. How well is the policy known? How consistent is it adhered to? Are managers competent and comfortable in their role and responsibility in managing absence, or are they putting too much responsibility onto HR, for example? Are return to work discussions taking place? If so, how consistently? Are you recording the outputs of it so you can then action on that? Are stress risk assessments or discussions taking place? If so, how consistently? Do our managers know why they're important and when they should be done and how to do them? Are your protocols and procedures for short and long-term absence applied consistently? Think about things. Could what you have at the moment negatively influence early identification of issues and ultimately minimize barriers to accessing support? Because, of course, people reporting periods of sickness absence is one critical entry into that support, the proverbial support network, if you like. Do you have variations in sick pay? Could that negatively influence reporting, for example? Megan, next slide. And of course, my absolute favorite, how about your employee data? What and how are we asking now? What are we going to be doing going forward? And what, importantly, are your employees telling you? We've seen a huge growth in pulse and engagement surveys since lockdown as employers are striving to get closer to their employees. But are we asking the right questions? Are we interpreting? We've got mental health and well-being is covered in various or personal injury claims such as psychological injury.
Hi everyone, we're aware that Stephen is cutting out at the moment. He's had to join on a mobile phone due to a technical issue, so just bear with us. Hopefully we can get his signal fully restored.
Can you hear me now, James?
Yeah, you were just cutting out a bit. It's been okay for the majority of the talk, although you've had a couple of dropouts, but just then it was more not hearing anything than hearing you.
I'm so sorry about that. Okay, can you? Well,
It's okay.
let's close. Let's close off on the last bit. Yeah. Okay. So, if we just take a step back, covered under various legislation. So, of course, if we fail to comply with that, we could face risk of disciplinary claims, stress claims, personal injury claims, for example. We know under the 1999 Management Health and Safety at Work regs that companies have got a duty to assess the risk of stress-related, i.e. exposures to work-related stresses. And we've also got the 74 Health and Safety at Work Act, which, of course, where we've got to take measures to control any risks that we identify. There's various ways in which we could do that, whether it's individual one-to-one stress risk assessments, to site and project risk assessments, to group-wide surveys and focus groups. And if we're thinking about the survey model, which is really critical, we've got to think are they designed to enable ease of benchmarking against existing survey sets? Focus groups or employee representative groups. So just in closing, ultimately, having robust and holistic data will drive an effective workplace wellbeing program. Optimizing our support infrastructure and getting the most out of our measures on what's actually driving our data is also vital. Megan, let me just close on to the last slide. Thank you. As I mentioned at the beginning, Think Talk Together is part of the Mates in Mind charity. And if you would like to help Mates in Mind continue to help raise awareness and address the stigma of mental health across UK workplaces, you can make a donation to the charity by heading over to Just Giving and searching for Mates in. It's a pleasure to be with you, open to any questions. And apologies for any signal issues.
Okay, thanks very much, Stephen. I'm not sure how successful the question session's going to be, but we'll give it a go. It might be an idea if you open a window and sort of hold your phone outside and wave it around a bit, perhaps. But we do have a few questions from the audience.
Sure.
So the first one is, how do you recommend we go about capturing the right data and analysing it properly? Are there programs to allow this to be done in-house, or is it best to outsource this for a medium-sized company? And that sounds like the opportunity for a plug.
Thank you, James. Okay, that's a really interesting question. First and foremost, yes, you can obviously outsource it. Mates in Mind, we do a lot of this work, but also there's no reason why you couldn't do it yourself. And I suppose critically, it's about looking at all of the relevant data you've got. Think about all data you've got. Then your second task is almost establish how credible is that data? How much of an informed picture is that actually give us? Absence data, and it's your EAP data, and it's your occupational health outputs, for example. If you looked at your absence data, you realize actually we know that the policy is not really adhered to, and we know indicatively that actually it's probably only about giving us only really sort of 20% accuracy of that particular part of the picture. Likewise, if you look at EAP data, if you see that actually we've got no management referrals in place, there's no peer communication, people are only using it if they happen to see the posters or the equivalent of, therefore we're not maximizing utilization, so therefore it's only going to be giving us a very partial picture. So again, it's just looking about how credible each data set is, but critically looking at what data you've got. So I think your first point is look at what you've got, then look at how strong that data is, and then look at them both as two together. How can we optimize both?
Okay, great. We did actually hear the majority of that, so that was good. And this is pretty much a follow-on question, or at least a related one anyway, and it's, can we start a wellbeing program without data?
Was the question, can we start a wellbeing program without any data?
Yes, yeah, it was. Yeah, can we start a wellbeing program without data? Yeah.
It's a really interesting question. I think ultimately an organisation could do anything, but I think at the end of the day, the well-being of our workforce is so critical to not just our people, but of course the success of the business. And ultimately, would you want to do something based on uninformed data? And if you don't know what you're actually addressing, how do you know what to put in place? Yes, there's lots of obvious things you can probably put in place, which will probably have lots of value. But if you don't know what your starting point is, you won't necessarily know what the output will be. You won't necessarily know what the journey, the distance traveled would be. So obvious things you would probably benefit from in a wellbeing program would be about instilling basic principles of things like psychological first aid across the entire workforce. So basic peer support networks. So building up the concept of, it's okay to talk, it's okay to open up. Importantly, upskill the managers in certain basic skills around mental health and well-being, so you start to build upon that supportive environment. Those are obvious things to be doing. Obviously, upskilling leadership in attitudes, behaviours, competencies, etc. So there's lots of things you could be doing, but ultimately, I would say your starter for 10 is think about what you want to be targeting. I've just done a big project with an organisation, which interestingly, we identified one key theme was, out of many of the focus groups we ran, was big disconnect between what senior leadership's perspective was before doing any analysis compared to what the perception of well-being was at the ground level. At the ground level, it was very much well-being to me is, if I'm lucky, I'll come back from the gents and I won't have my supervisor tapping their watch. Whereas at the senior leadership level, it was very much we genuinely care about the well-being of our people. We just don't know where to start.
Thank you. Okay, next one. Some of the discussions around primary, secondary, and tertiary interventions feel very much like Maslow's hierarchy. Is this something which is still used and seen as relevant in the drive towards well-being, assuming that the question is indeed correct?
Yes, that's a really interesting one. I mean, yes, it does sound very academic, doesn't it, when we talk about the primary, secondary, tertiary. I suppose ultimately what all we're trying to do is trying to think about ways in which we can categorize the interventions and recognizing that the support services that we've got in place are tertiary. They're there to support a point of need, but ultimately we want to be addressing the work design. We want to be identifying what are the things which make our people well, what are the things that make our people happy, what are the things that make our people stay in our business. So helping us break those into those sort of three simplistic categories is very helpful. They were largely used to begin with, largely to do with stress management in workplaces, and we've started to see them become more commonly referred to in more sort of broader wellbeing interventions.
Okay, excellent. Okay, we've got a couple more. So this one's been asked before to previous speakers, but it's still quite a good question to ask. And it's, how do we ensure that wellbeing remains a priority for organisations and leaders after the impact of COVID-19 subsides? And the impact of poor wellbeing may not be as obvious or as widespread.
Sorry, James, I lost you just in the middle.
So it was, how do we ensure that wellbeing remains a priority for organisations and leaders after COVID-19 when it may not be as obvious or as widespread?
It's a lovely question, because I think if we think about where we're going, if we get to a point where we've been over the past 10 months and where we're going, the data informing where we're going is really critical. And I think one of the challenges with why wellbeing has been a bit stop and start over probably the last sort of 5 to 10 years, I think has largely been based on data. 5 years ago, I was still having the conversation with organizations where they would say, yeah, but what's the business case? And then equally, the response would always be, well, what is your data telling you? And in a lot of cases, many organizations weren't capturing the data. Well-being is not about the fruit on Friday. Well-being is not about, which medical insurance scheme we've got or which gym membership we've got. These are facets of a much wider dynamic. But ultimately, this is about optimizing the way of work, making sure our people are happy, making sure we're identifying the issues so we can mitigate them, so our people can thrive and we can provide. Shouldn't really cost anything. If we come back to the primary, secondary, tertiary, the primary stuff, that's actually, that's probably 20% of the spend. It's the tertiary and the secondary where you've got your 80% of your spend, which is where you've got the board, the uninformed board that may still sit there and go, yep, well, we've done Wellbeing now. We don't need to worry, we can move on. You never get to a point where we've done Wellbeing. Wellbeing is not a tick box.
Okay, I'm not sure if you finished the answer or if the sound cut out again, but I'll assume that we're finished. So last question then, and that is, in as few words as possible, for a medium-sized organisation, let's say 500 people, how long should an organisation give itself to set up a wellbeing program?
With 500 staff, I would say probably about 4 to 6 weeks to gather the data, 2 to 4 weeks to start putting in place the implementation. So I would say within 2 to 3 months, you could have a good program getting off the ground. But
okay,
remember, you've got to have the right structure around that, the right people informing that, and the right program steering.
Okay, brilliant. Right, Stephen, thank you so much for that. That was really interesting, and we've had some great feedback.